Hi everyone. Welcome to week 4 of your Pharmaceutical Career Planning 1 course. This week we are covering Chapter 7, which is all about home infusion pharmacy. So this is just a brief overview of home infusion pharmacy. So the idea here is that a home infusion pharmacy is any pharmacy that's going to prepare and dispense infusion therapies for patients in their home or an alternate site type of setting. So this can actually happen within other types of pharmacies. So it might be happening in a hospital pharmacy. It might be happening in your community pharmacy or a long-term care pharmacy. Or it might be happening in a pharmacy all of it in and of its own self. So there's a lot of different ways that home infusion pharmacy is managed. But there's as long as somebody is doing home infusion, they can be considered a home infusion pharmacy. So in other words, it can be within other types of pharmacies, but that piece of the business is considered home infusion pharmacy. So these are just some of the different types of therapies that you might find done when we think about home infusion. Home infusion, again, is just where we've got somebody who's getting some sort of treatment within their home and it's being infused. And by infused, that means it's going through an IV into the patient. Okay, so it could be some sort of anti-infective therapy. A lot of times this is something that's done on a patient, after they've had a major surgery of some sort, or maybe they've have some sort of acquired immune deficiency, something like that. Antifungal therapy, pain management. Pain management is going to be done typically on those patients. Maybe we have a terminally ill patient, and they're having pain management therapy. Chemotherapy, obviously for cancer. Nutrition therapy. Nutrition therapy is for those who may have something going on that they're not able to take nutrition by mouth and process it at this point in their disease state. So this is another way to get the nutrition that they need without having to eat regular solid foods and things like that. We also have hydration therapy, biotechnology therapy, miscellaneous, so anything that really doesn't fall into those other groups kind of would be dumped into that bucket, and then ancillary drugs. So they're going to kind of go through in this PowerPoint and talk about some of the things that might fall into each bucket. Anti-infective is actually the most common type of infusion therapy. This is where we have antibiotics, antifungals, antivirals all fall into this. So an important note on this one is those antivirals. This would be your HIV type of therapy. So that's why that falls into this bucket. That's probably why this bucket is the largest. Antifungal is used to treat any kind of persistent or serious fungal infection that's not responding to oral therapy. So if the doc's already tried oral therapy, this is for those really tough types of fungal infections that they're trying to treat. Pain management is, again, chronic pain, and a lot of times we think of this in the hospice setting, end-of-life settings, where we've got some sort of chronic pain going on. And this could be, an IV type of thing. It could also be sub-Q, it could be epidural. Any of those types of things are used for pain management. Now, keep in mind, though, we're only talking about infusion therapy here. So if they're doing pain management with a patch of some sort, that would not fall under home infusion. Okay. Chemotherapy, which is any of those anti-neoplastics that's used to treat chemo, they are chemo and they are used to treat cancer. So those will be things that typically are done like over several days at a time. And then there's time off. They might do this every 3 weeks, something like that. So that would be chemotherapy. And again, keep in mind that when we're talking about home infusion, it doesn't necessarily have to be in a home setting. It's just not in an inpatient setting. So you might know of folks who've gone to an outpatient setting to get their chemotherapy, and that's kind of what we're talking about here. Excuse me. And then we have nutrition. There's two different types of nutrition therapy. Enteral therapy is using the GI tube, and then the parenteral is going through a vein. So enteral is going directly into the GI tract, whereas parenteral is outside of that GI tract, so going into the vein. Hydration therapy is fluids, so just replacing the fluids that you've lost due to dehydration. Biotechnology is administration of biotechnology drug products for different types of conditions. So these are just, again, long-term care types of things. What they throw into miscellaneous is just these things. Any IV, sub-Q, or conventional IV injection that wasn't already included in some of those other things. And then when they talk about ancillary drugs, so these are just any other type of injectable that's used to assist with other therapies. Excuse me. Sorry about that. And then we have, the flush thing. So any kind of saline flush that's being used to block or to prevent blocking of a IV port, things like that. Of course, when we have a home infusion pharmacy, we're going to have personnel, we're going to have inventory, we're going to have a different type of look to the pharmacy, different type of equipment, and of course it has to get there, so delivery service and things like that. So the next part of this is going to go through and talk about those different types of personnel. Of course, we're most interested in the pharmacy technicians and what they are like and what they do. So once you read about the design of the pharmacy and how all of that works, you're going to have a better idea of where you would fit in this type of setting. If you have any questions as you go through the rest of this chapter, please reach out and let me know, and have a great week.